Hi, meet Steve and Sally. They are both from Utah. Also meet Ali and Alina. They are from Pakistan. Even though they live across the world from each other, they both experience air pollution, like CO2 emissions, dust particles, nitrous oxides, and VOCs. The nitrous oxides and VOCs combine together with the sun to create ground level ozone or smog. In Utah especially, this smog can be seen in the winter. This is because with the inversion, the warmer air trapping the colder air beneath also is trapped by the mountains, and the smog accumulates. That's why in the winter we are more concerned with our air pollution, but it is year-round. What are some of the sources of air pollution? Ammonia and methane gas come from agricultural activities, especially cows. Sulfur oxides come from energy production. Natural phenomena like sandstorms and volcanoes contribute to the particulates in the air. Landfills and coal mining are sources of methane gas. Our transportation contributes to the nitrogen oxide and particulates in our air. And finally, fuel combustion is a key contributor to our air pollution. Houses and buildings contribute to the carbon monoxide and particulates also in our air. There are many sources of air pollution. Next, our expert in Pakistan will talk about industrial pollution.
Day by day, with more development and increase of more motor vehicles in Pakistan, we can think that air pollution in Pakistan is increasing because of three main reasons. One reason is motor vehicle emissions. In cities, particularly in Lahore, Karachi, Islamabad, the number of motor vehicles is increasing, and we don't have enough laws and enough measures to control those pollution. The second one is from agriculture waste in rural area, where people burn their agriculture waste for preparation of next crop. That produce a lot of fog and particulate matter, and it become very worse in the winter season. The third reason is industrial source. So we have now more industries coming in Pakistan, like cement industry, like a textile industry, and other industries like steel industry and energy industry. So those industries which burn fuels, ultimately they emit different kind of contaminants, including particulate matter or NOx and SOx, and we don't have enough laws to force them to install proper equipment. So because of that reason, a lot of pollution is coming within the cities, and we don't have any way to control that.
Infograph from the World Health Organization highlights this impact. They stated 7 million deaths are due to exposure from both outdoor and household air pollution. And these include strokes, heart disease, lung cancer, respiratory diseases, and also asthma. And this affects people worldwide. The people who are most susceptible to air pollution effects are kids, adults over 65, smokers, pregnant women, and those suffering from heart or lung conditions.
Air pollution can have a huge impact on the human body. First, though, we need to know about the three regions of the airway. First, we have the nasopharyngeal airway, which is the nose to the trachea. Next, we have the tracheobronchial, which are those connecting airways. Lastly, we have the pulmonary region, which deals largely with gas transfers. This first region, again, the nose to the trachea, the nasopharyngeal region, is the port of entry. The air pollutants are inhaled through the nose or the mouth, It's kind of like the first barrier of defense where these larger particles won't make it beyond that region. Next, we have the tracheobronchial region, which are the connecting airways, which are like the trachea down to the terminal bronchioles. This kind of makes up like that middle airway, and it connects to your neck and your lungs. Lastly, we have the pulmonary region, which deals largely with gas exchanges. These are the terminal bronchioles, like the alveolar ducts and the alveolar sacs. And again, these deals largely with gas exchange, where the oxygen will come in to these sacs, will go into the bloodstream, and then the CO2 will then be removed from the bloodstream through these same sacs. So they're really important and crucial to our respiratory system and functioning properly. These larger ones, they can lead to asphyxiation. They can trigger asthma attacks. There's these larger ones that can easily block up the pulmonary region. Otherwise, these smaller ones that get into the lungs, into the smaller alveolar sacs, can have a big impact by causing long-term health effects such as COPD and lung cancer.
We can start riding bikes more and taking public transportation, use more efficient energy solutions, and talk to our representatives in our governments.